Thank you, Michelle, and a pleasant good afternoon to everyone. We welcome you to the special edition of the NEOC COVID-19 briefing. It's my task to share with you the Health Emergency Operating Committee's situation report for today, Thursday, December 30. We are presently in the fourth wave. We are presently experiencing the fourth wave of COVID-19 infections. We can safely say that this wave started last Friday, Christmas Eve. If you've been monitoring the information disseminated by the Ministry of Health, you would recognize that there is an uptick, a surge in the number of newly diagnosed cases each day. Just yesterday, we reported an additional 41 cases. So when we look at this past week, starting last Thursday to present, we've added 103 newly diagnosed cases of COVID-19 to our tally. Now, this brings our total to 2,918. In terms of hospital admissions over this past week, we've only had one, and no discharges, and we have not added any additional COVID-19 related deaths. And so this is our summary slide. This gives you a snapshot as to the COVID-19 status currently. So far, the Federation has reported a total of 2,918 confirmed cases of COVID-19. We continue to enjoy an excellent recovery rate. We have noted 2,784 recoveries so far. So at present, we are monitoring 106 active cases, 25 of these cases on the island of Nevis and 81 of these cases on St. Kitts. So far, we've had a total of 28 COVID-19 related deaths, and at present, just one case admitted at the JNF General Hospital. In terms of the 2,918 cases, based on our analysis, 68% of these cases are unvaccinated. Only 25.5 or 26% are fully vaccinated, and the remainder, about 6.57%, are partially vaccinated. So it remains a disease impacting the vulnerable and the unvaccinated amongst us. So I want to use this plug to reach out to those who are not yet vaccinated. Empower yourself with the latest information and come on board and, have enjoy a level of protection against COVID-19 by consenting to the vaccine. Our vaccination program continues. In 10 months. We have achieved the following coverage rates. 81.3% of the adults in our population having come forward to receive the first dose, and 75.7% of the adults in our population are fully vaccinated. In September, we started offering the Pfizer-BioNTech vaccine to our teenagers, 12 to 17 years. So far, 16.2% have received the first dose, and 14% are fully vaccinated. In terms of the boosters, I want to congratulate the older adults amongst us and those who felt vulnerable and who have come forward in terms of accepting the booster shot. 5.1% of the adults have come forward so far and are boosted. In terms of the total population, 54.4% of the total population in the Federation fully vaccinated. And so you can look at the table, you would see the figures disaggregated by island. And so this gives you an idea as to where we are at. I just wanted to congratulate the population. It's the second to last day of the year in terms of you're empowering yourself with information about the vaccine. You're coming forward in accepting same in terms of providing us that coverage because we are now in the fourth wave. But I want to just underscore that we still have about 45% of the population not yet fully vaccinated. And the virus is going to continue targeting the unvaccinated amongst us. The Omicron variant came to the fore towards the end of November. It has been labeled a variant of concern by the World Health Organization. And so the main reason for this afternoon's emergency press conference is to inform and update the general public about the results that we have just received. And so on December 22nd, the Federation sent off a small package, 3 samples to the Caribbean Public Health Agency for genomic sequencing. You may ask why just 3 samples? We were down at an all-time low in terms of our daily case counts, and these 3 samples met the criteria for genomic sequencing. 2 of the 3 samples returned positive for the Omicron variant of concern. I repeat, 2 of the 3 samples returned positive for the Omicron variant of concern. Now, so this provides us, when we look at the data pertaining to these 2 samples, the 2 cases, we have objective evidence that the Omicron variant is in circulation in the Federation currently. The Lambda variant has been in circulation for the past 7 months. And so we have 2 variants in circulation, the Omicron variant and the Lambda variant in circulation currently. So what's the latest information about Omicron? Now, this variant was first identified in South Africa towards the end of November, beginning of December, but it's spreading rapidly. Over 100 countries, territories globally are already impacted. It's spreading like wildfire. Omicron carries a number of mutations not seen in the previously identified variants. Based on the scientific data regarding this variant of concern, we must note that Omicron is much more transmissible versus the Delta variant. And so we need to be very careful. So if you are in the presence or company of somebody infected with Omicron, it's highly likely that you will be impacted. Current detection methods continue to be adequate in terms of the diagnosis of disease or COVID caused by Omicron. So in other words, the PCR tests and the rapid antigen tests are still able to diagnose Omicron, meaning most of the rapid antigen tests. I think the CDC has identified a number of rapid antigen tests that are not effective in identifying Omicron. Anecdotal evidence so far suggests that the disease caused by Omicron is less severe versus the disease caused by Delta variant. And so this is the ray of hope as we discuss and consider the potential impact of Omicron. So it's much more transmissible than as compared to Delta, but the disease it causes seems to be less severe. So the World Health Organization warned yesterday that the ongoing circulation of the Delta variant and the emergence, the rapid spread of Omicron can cause a tsunami of infections, which has the potential of overwhelming the health system. So we have to be careful and not trivialize Omicron. The global average of new cases hit a new high with more than 930,000 cases this past Tuesday, December 28, according to the New York Times database. The previous high was about 827,000, which was realized in late April of this year. So the Delta and Omicron are now twin threats, driving up cases to record numbers, leading to spikes in hospitalizations and deaths in some countries across the globe. But the good news is that the COVID-19 vaccines still appear to be protective. The vaccines still provide a significant level of protection against severe illness, hospitalizations, and death. The Omicron outbreaks around the world started primarily in younger age groups, and the variant is now impacting older populations. So what you find is the younger persons in households take it home, and it impacts the older adults who are chronically ill and who are otherwise vulnerable. Early data suggests a booster shot is needed to restore protection against Omicron. Though the initial vaccine regimen might still be enough to fend off severe disease, people who survived a prior case of COVID appear to be at risk of reinfection from Omicron. And so, in essence, we need to be vaccinated. Vaccination provides significant protection against moderate to severe disease, hospitalizations, and death. And persons who've had COVID before, in terms of in our population, persons would have been infected with the Lambda variant. The risk of reinfection with Omicron is still noteworthy. Now, in the United States, because it's a source market, we need to realize that the variant is now detected in all of the 50 states, and that the Omicron variant has surpassed the Delta variant and is now the dominant variant. So the most prevalent variant in circulation in the US is now the Omicron variant. The highly transmissible variant is causing near vertical case growth in multiple US states, with figures doubling about every 2 to 3 days. The US is expected to reach 1 million cases in a day. So this just gives you an idea as to what's happening in the US. Most of our visitors are originating from the US. So here in the Federation, what's the way forward? Well, we are continuing our COVID-19 vaccination program. So the Ministry of Health is being intentional in targeting the vulnerable amongst us, meaning the older adults, those with chronic diseases, those who are immunocompromised. We are intentionally targeting them and bringing them on board in terms of even just the primary vaccine series. We are collaborating with the Ministry of Education in targeting our teenagers, because the vaccine is available for the 12 to 17-year-olds. The coverage rate is still below what's acceptable for us, and we really need to push vaccination amongst our teenagers, because they are now vulnerable, and the potential is for the Omicron to take hold on or impact our teenagers. Now, the Newtown Health Center will be open on Sunday, January the 2nd, between 1 to 5 p.m., and again on Monday, January the 3rd, between 9 to 1 p.m. To facilitate the administration of the COVID-19 vaccines. And so we want those amongst us to capitalize on this opportunity in terms of getting vaccinated and protecting yourselves. We are increasing the testing opportunities for persons who are experiencing COVID-like symptoms. And so if perchance you're experiencing fever, sore throat, sniffles, coughing, And if you think you've been exposed to COVID, you can come out to the Bastia Health Center car park, the Mary Child's Hospital car park, and Poxon Hospital as outlined. And so on Tuesday mornings, 6:30 to 7:30 a.m. Bastia Health Center. On Wednesday morning, 6:30 to 7:30 a.m., Poxon Hospital car park, and on Thursday mornings, 6:30 to 7:30 a.m., Mary Child's Hospital car park. I repeat, Tuesday mornings, 6:30 to 7:30 a.m., Bastia Health Center car park. Wednesday morning, 6:30 to 7:30 a.m., Poxon Hospital car park. Thursday mornings, 6:30 to 7:30 a.m., Mary Child's Hospital car park. And this drive is to facilitate testing for persons who are experiencing COVID-like symptoms. In terms of physical and social distancing, now it's the second to last day of the year. Tomorrow is All Year's Day and New Year's Eve, and it's a time of, persons coming together, socializing. And so it would be, I can't say to avoid interacting with persons at this time of the year, but I want us to be wise and use our discretion as we choose to socialize and get together to interact with our friends and loved ones. So I want to use this opportunity to reach out to organizers of events and functions. Please note that we have objective evidence that the Omicron variant is in circulation. It's highly contagious. And if you have one individual amongst a group who is infected with Omicron, chances are the others in that group, they are at risk of becoming infected. And so we need to be mindful of the number of persons that you are inviting to whatever event, function, social gathering, family gathering. Please note the space or the area that you are going to be using and make sure that the number of persons you are inviting, that you bear in mind the need to have a space, adequate spacing between individuals. And these events and functions should be held in well-ventilated spaces. Open air spaces are recommended. And we want attendees and patrons to wear a face mask. It's preferred at this time, seeing that Omicron is so highly contagious. If you have access to the surgical face mask, it offers a significant level of protection. If you have to wear a cloth mask, you could double it. Wear 2 masks. It would provide you an increased level of protection. And please do maintain adequate hand hygiene. Keep your hands away from your face. And so as we approach the end of the year celebrations and the New Year celebrations, we want you to bear all of this in mind, recognizing that the Omicron variant is highly contagious. In other words, you don't even have to interact significantly with somebody who is infected to become infected. It could just be a casual passing interaction, and the risk of your becoming infected is significant. So that's how highly contagious the Omicron variant is. And so wearing of the face mask at this time is of paramount importance. Please don't let your guard down. And so if you're out socializing, what I've been doing is, I attended a luncheon yesterday, and I kept my mask on between bites and between sips of eating and drinking. So that's the level of precaution we want you to attain to as we work our way through this 4th wave. You must maintain hand sanitization, hand hygiene, keep your hands clean. So once you've transferred given somebody something or taken something from someone, touch a high touch area, make sure to sanitize your hands. And of course the vaccine. If you are not yet vaccinated, and if you feel vulnerable and 6 months or a number of months have elapsed between your last dose and present, you can come forward and be boosted. And try as much as possible to maintain a safe distance between yourselves and others when in a social setting. I want to utilize this opportunity to wish the people of the Federation a happy new year. I want to also say thank you to our people for your support throughout 2021. You've supported us here at the COVID-19 Task Force and the Health Emergency Operating Committee. You've provided us support in terms of our response to the COVID-19 pandemic. And you've come on board in terms of the all of society approach in our response. So we want to thank you. And at this time, we want to wish all of us a happy new year come Saturday. And I want to wish us all a better 2022 versus the 2021 that we've just gone through. So again, happy new year to everyone. Thank you.